Hi guys, finished an awesome GP Stage 3 course in Birmingham. I thought we'd do a really quick video on ICE, ideas, concerns, expectations, and the importance of reflecting answers back to make it sound like you genuinely want to know these things rather than I've got to know these three things for a medical exam. We talk about this a lot on our CSA, our GP Stage 3, and our plab 2 courses. Now, when people talk about ICE, I often get asked, what's the best way to make it less formulaic? And people talk about a lot of things. They talk about, don't use the words ideas, concerns, expectations, or change the question so it doesn't look so obvious, or do ICE at a certain part early on, later on, or split ICE up, don't do it together. These things are great, but one of the most important things to make it sound less formulaic is to think about how you reflect the answers back. Now, when you talk about ICE, you're trying to find out issues in the patient's mind, aren't you? So often they're telling you things that are quite important in here. They may not have told anybody else. We've got to reflect things back to show that actually, that's really important. I've understood what you've said, and I genuinely wanted to know that because that's important for me to think about how I manage this whole situation going forward. Say, for example, I'm seeing a young guy with back pain. Now, we can ask three pretty nice questions, we can get three answers, but we could do it in a formulaic way because we don't think about reflecting anything back. Mr. X, a lot of causes of low back pain. Wondered if you had any thoughts as to what might be going on yourself. Oh, I've probably just pulled a muscle in my back, doc, to be honest. That's probably all it is. Now, most people move straight on to C now. Was there anything you is particularly worrying you about all of this? Oh, doctor, I do loads of lifting at work, and if I can't lift, they're going to sack me. Now, most people move straight into the E question. Was there anything that you thought that we could do, particularly while you were here today? Oh, my uncle, he had an MRI scan, yeah, maybe I need one of those. Most people just get the answer and move straight on. Now, it doesn't matter how nicely you've asked that question, it doesn't matter where you've done it in the consultation, they're going to sound like three sticks that just stand out in the middle, formulaic. So what we talk a lot about is giving a single line of reflection or a genuine response back to an answer before you think about moving to the next question. Show that I really did want to know that and I really understood and processed what you said and I recognize the importance. Mr. X, a lot of causes of back pain out there. I wonder if you had any thoughts as to what was going on yourself. Yeah, I'll probably just pulled a muscle in my back, to be honest. Yeah, maybe that's probably one of the commonest type of back pain reasons that we see in young people. I can see why you might think that, but clearly this is affecting you in a big way. And was there anything particularly worrying you here? Oh, doc, I do loads of lifting at work, and if I can't lift, they're going to sack me. Wow, okay, fair enough. I can see why it's such a big deal. And you mentioned work, and we'll come on to that in a second. It sounds like it's pretty important. Now, obviously, you've come here. We're going to try and figure out what's going on. You mentioned painkillers already. Was there anything maybe you thought that we could do for this while you were here? Oh, my uncle, doc, he had an MRI scan, and maybe I need one of those. Yeah, maybe. I mean, we do MRI scans for back pain, and maybe once we've chatted things through, examined you, maybe we can have a chat about that later on. And then I close down. Now, that's the same three questions, it's the same three answers, but by reflecting the answer back, it shows I genuinely wanted to know that answer rather than thinking, give me the three answers because it's a medical exam and I need to do ICE. So when we talk about formulaicness of ICE, there's lots of ways to make it sound less formulaic, but one of the most important things to work on in your practice is reflecting answers back, because that can sound a whole lot better than just doing a question and an answer and moving straight on to the next question. Whether ICE is done together or whether it's done split apart, think about reflecting answers back. We do this all the time in real life, but when it comes to medical role play scenarios, we tend to focus on the question more than the way that we respond to the answer. Much more like this on our CSA, GP Stage 3 and plab 2 immersion courses. Look forward to seeing you there at one of those in the future. Hashtag Can't Pass Will Pass, hashtag I went with Arora.